meeting for June 2nd, and I'll ask the secretary to call the roll.
Yes, sir. Start with you, Commissioner Chow,
Present?
Vice President Guillermo,
Present.
and Commissioner Guggenheim. Thank you so much. I will read the land acknowledgements. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land, and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. Before we move on to the next item, I want to announce to folks who are maybe watching at home that the order of the agenda will change a bit. Item 3, the monthly contracts report, will be heard after item 11. So all of the new contract requests will come in and be discussed and decided upon first, and then the monthly contracts report. The next item on the agenda is item 2, the approval of the minutes of the Health Commission Finance and Planning Committee meeting of May 5th.
Commissioners, the minutes are before you for approval, and a motion is in order.
I'll move approval.
Is there any public comment?
Any public comment in the room on the minutes? All right, I see none, and there was no one was given permission to provide remote public comment. So all those in favor?
Aye.
Aye.
All right, thank you. We'll move on to item 4, request for approval of a new grant agreement with Code Tenderloin, which is the fiscal sponsor for New Music San Francisco Incorporated. And everyone, please, when you get up, introduce yourselves and say your title, and then we can move into the business.
Thank you, Commissioners. My name is Robert Sinsuwa. I'm a contracts manager for Overdose Prevention, Behavioral Health Department of Public Health. And joining me today will be Chris Farrell for Code Tenderloin. He's a strategic director for Code Tenderloin. Yes. We are seeking approval for a new grant agreement to support Code Tenderloin's CHOP contract. This is a community holistic overdose prevention program. It's focused on overdose prevention, education, outreach, and community navigation. This contract is designed to address the overdose crisis, especially among older Black African-American San Franciscans who are dying at 5 times the city opioid overdose rate. The program welcomes and serves all ethnicities and populations within San Francisco, but it has a focused expertise to meet the unique cultural needs of the Black African-American residents in San Francisco. CHOP integrates naloxone distribution, overdose response training, peer-led outreach, warm handoffs to treatment, medications for opioid use disorder outreach, with built-in capacity building in the first 6 months of year 1. Services will be citywide with an additional focus on the Bayview neighborhood, leveraging partnerships with community-based organizations and medications for opioid use disorder providers such as the DPH Telehealth MOUD line, Bayview Hunters Point Foundation, and the OTOP Bayview Methadone Van. The program also includes community empowerment through stipends and wraparound supports to increase access and trust. This contract aligns with DPH's overdose prevention strategy by addressing racial disparities, building community capacity, expanding access to life-saving interventions, and connecting people to the continuum of SFDPH substance use services. The funding comes from a blend of the CDC OD2A grant, the CDPH fentanyl grants, MHSA, and the Opioid Settlement Fund. Thank you so much.
May I ask if there's any public comment? Is there any public comment in the room on this item? I see none, commissioners.
I'll just start with the first one. I'm assuming that in our proposed transaction, the initial year is listed, and then it's blank for all ongoing years, but presumably they're the same.
They're the same.
Okay. Commissioner Aki.
Yes, thank you for your presentation. I am just a little bit more detail on the capacity building and needs assessment processes.
Okay. Is this something that you can talk about, the capacity building? Or so basically the first 6 months of the contract is to allow Co-Tenderloin to build capacity and also do a community needs assessment to sort of make sure that they are directing their needs exactly where it's needed in the community. And at the end of it, of the 6 months, they are supposed to produce the community needs assessment to DPH, and we will evaluate it together and make decisions from there.
So after the needs assessment and the capacity building, if there's some adjustments that need to happen with either the units of service or the sort of targeting within the community, is that what you're saying?
Mostly service deliverables, but it has to be fit within the contract because they have to apply for it and everything. So those deliverables are set. But if there's a slight pivot we need to make in surrounding how we need to do the outreach, we might have to change that depending on the needs assessment.
And then I know there's another part, another program that's
Yes.
going to be funded. I'm just wondering what, maybe I could wait till after that presentation, but sort of the coordination or any information sharing or data sharing between the two programs that is going to be happening.
So the second program is through Homeless Children's Network. It's it's a little bit different from what CHOP is going to be doing because, Co-Tenderloin is going to be doing. The main difference is in year 2, they're going to be having the resource fair, and also they're also going to have a speaker series, which is very community oriented and very specific to Co-Tenderloin. And the other part that is different is the Bayview navigation, which is with a specific location in the Bayview neighborhood. But I can't speak too much on the
Yeah, I'll
ECS
wait for
side,
that. Yeah.
but we'll wait for that when it's presented.
Okay. Thank you.
Oh, pleasure.
I actually have one question, which isn't so related to the program, but the names.
Okay.
So it says the vendor is Center for New Music in San
Yes.
Francisco, which doesn't sound too
That's a great
social
question.
welfare oriented. And then how did you come up also with Co-Tenderloin?
Okay. So the Center for New Music is the fiscal intermediary for Co-Tenderloin. And for the background of Co-Tenderloin, I'll give it over to Chris for him to give you a little bit of an overview.
Thank you for that question. The Center for New Music is the fiscal sponsor for Co-Tenderloin. Co-Tenderloin operates as an entity under the Center for New Music right now. We are moving to our own individual entity. However, since 2015, Co-Tenderloin has operated in the Tenderloin community, operating with those to remove barriers to jobs, to housing, specifically focused on Black and Brown individuals, just as this contract will be. So it's been our focus since 2015, and with our Night Navigator program, the things that are in this contract, the things that are there for the program to do is what we've already been doing, and we're just going to expand it and continue.
Okay, so Project Tenderloin has been around and been doing a lot of work.
Yes.
So why is it that we need a fiscal intermediary, or are you intending ultimately to become the, prime holder of this contract?
Yes, sir, we are. At the present moment, when the contract started, we were in the process of completing our own entity, the 501c3. All of the paperwork has been completed at this point. And the Center for New Music, when this process started, was and is the fiscal sponsor for Co-Tenderloin.
Well, do they do new music also, or what I want to know is their experience in being an FI for the type of work that we're talking about.
That is Co-Tenderloin. That's what we've always done, and that's what we've been doing. The Center for New Music is just, for lack of a better word, the shell. But Co-Tenderloin has been and is doing the work.
Okay.
Oh, sorry. Yes. You have to turn on. I'm sorry, physically turn on.
I think this is just the administrative arrangement right now. Co-Tenderloin is the provider that we work with on a range of things. They are incredibly effective with their Night Navigator team, If you read about our street teams and some of the night navigator work that has been profiled, that's Code Tenderloin doing that. They're incredibly skilled and effective. They're one of the best resources we have. This is how the mechanics work out right now for contracting, but as our Code Tenderloin colleagues mentioned, I believe they're trying to move to be able to have their own back end. So this is really just some of the back end infrastructure required for Code Tenderloin to be able to contract with us. We will move away from that, but it really is a proven, known contractor provider to us.
Okay,
Thank you.
if we have no further questions, then we're prepared to entertain a motion for recommendation to the commission.
I'll move approval, recommendation for approval. Second.
All those in favor?
Aye.
Thank you. And could you give your name for the record?
My name is Chris Furl,
Thank you.
Firle.
Thank you very much.
Thank you.
All right, thank you.
Thank you both.
All right, so we can move on. And that also was a good model for how these contracts should be discussed. They were presented clearly and concisely, and then everything moved forward quickly. Item 5 is request for approval of a new grant agreement with Homeless Children's Network, and this contract is the $3 million contract.
Yes. Good afternoon, Commissioners. Thank you for hearing this item today. My name is Kianya Vinson. I'm the Equity Contracts Manager with the Office of Overdose Prevention. I work closely with Mr. Samoa, who's just up here. I'm here to request approval of a new grant agreement. Oh, apologies. I want to introduce Dr. Kenneth Kim, who's on the line from Homeless Children's Network. He is their Chief Operating Officer. Okay, so here to request approval for a new grant agreement with Homeless Children's Network to develop and operate another community holistic overdose prevention program with a focus on peer support. And just a side note, these programs were both awarded through one RFGA that was submitted, I think, last year. And it was intentional to fund two different organizations, one with a peer support model and one with a community model. So that's why you're seeing two different ones. This BHS contract is part of our multi-pronged approach to provide community-driven and evidence-based solutions to reduce racial disparities in overdose deaths. We respectfully request the Commission's approval, and this contract amount is $3,095,400, which includes a 12% contingency. Funding is primarily with opioid settlement funds with additional funds from CDC's Overdose to Action Grant, as well as funding from the Mental Health Services Act. So that this contract will address overdose death disparities, which currently show Black African Americans dying at a rate 5 times that of the citywide rate. Of course, all San Franciscans would be eligible for services under this program. However, HCN will utilize their focused expertise to meet the unique cultural needs of Black African American residents. CHOP will provide naloxone distribution, overdose prevention and training, and warm handoff referrals to overdose prevention services. A primary goal of this work will be to link people who use drugs and those most at risk of fatal and non-fatal overdose with the DPH systems of care and to receive SUD and other services. HCN's peer support services will reach 100 unique clients, and they will also provide warm handoffs to services for at least 240 individuals per year.
Is there any public comment in the room on this item? Commissioners, I see no public comment.
Commissioner? This? Commissioner.
Just, could you describe the peer support model a little bit more, since that's the one that's different from the?
The intention was that they would train peer support specialists in their organization as part of this program. So they're going to have a peer support manager who will then oversee peer support specialists who will do outreach and overdose prevention training with a cohort of folks who will go through. They actually have a peer support program called Amani, and this would be, I believe, a separate program to supplement that. I might actually ask Dr. Kim if they have any specific ideas for this peer support model.
Yes, we do imagine that some of the participants of peer support will be separate from Amani, but there are also those that are participating in Amani that have lived experience and special interest in this particular program. So we imagine it'll be a mixed cohort, but we are expecting that they're to be both new and familiar. These would be folks that have graduated from the Amani program, so they would not be participating in both programs at the same time.
And I'm sorry, this is a quick reminder. Anyone who speaks, please turn your camera on. And also, could the person who spoke, could you introduce yourself so we know who you are?
Sir, my name is Kenneth Kim, and I am the Chief Operating Officer at Homeless Children's Network.
Thank you.
So just to be clear, so the 8 clients per month, that's those that are going to be trained or those that are going to be receiving the peer support?
Those will be the people receiving peer support.
Okay,
Yes.
thank you.
Sure.
Commissioner, any questions? I had one, which was a question as to the fact that we're doing a peer review and then we're also doing an outreach program. How will we be taking lessons learned, or are we going to have to take all 5 years to do that? Or what's sort of the interrelationship between the two so that we could adjust the strategies as needed, if any?
Part of our overall strategy to, was someone speak? Part of our overall strategy to reduce, preferably end racial disparities in overdose prevention or overdose deaths is to have all of the organizations that we are working with who are Black-led and Black-serving coming together on a regular basis to share resources. That's something that we've envisioned from the very beginning. So it's taken a while to get the contract certified and up and running, but what we want to do probably within the next 3 months is bring all of these funded CBOs together to talk about best practices, to talk about what have been the challenges with the capacity building phase, which is something that we heard folks really needed an opportunity to build capacity to provide these services, specifically culturally congruent services for the Black African American community. So no, I don't imagine that we will be waiting 5 years to get that data. We'll be hearing from them directly on at least a quarterly basis. And also they will all be doing data reporting to us on a quarterly basis that we'll be able to use.
Okay, all right, good. And I noted, and that's true for the other contract, that a
Yes.
portion of this is federally granted. So is that sort of assured as best as you know, or is that also on the chopping blocks?
As best as I know, that money is good and untouched right now. We do have the contingency, which I believe is made up of opioid dollars. So we have the ability, I think, to supplement that. But as far as I know, that money is safe. And it represents a small portion of these grants.
Sure, no, and we really do appreciate that it's broken out this way so that we can see the potential risk or lack of it. Commissioner?
Yeah. I'm wondering, yeah, even if it's not at the end of 5 years, but as you go along, how will success be defined and how will it be seen?
Part of our data reporting will include, you probably have a list of the UOS. So data reporting will include those as well as demographic information, race, ethnicity data, gender data, age data. What we were finding was that Black African American older men were dying at higher rates than any other group in the city. And so we hope to see those numbers reduced. We hope to see those folks served by these programs and then subsequently see those numbers reducing in our other data. You know, I think that data is sometimes, it doesn't have the whole picture. So I do believe that hearing from the CBOs on a regular basis will also inform our success. We'll be able to hear what their actual clients are coming in and saying, what are the interventions that have actually helped them progress on their path towards recovery. I don't know if Dr. Kim, if you wanted to add anything else as a marker for success.
No, I would agree with you that I think that our main point is to be able to add to best practices and model, as well as being able to give a clear narrative that supports the data.
Okay, any other questions? If not, a motion's in order to recommend to the commission the approval of this contract.
I'll move recommendation for approval.
Second.
All those in favor?
Aye.
Great, thank you so much.
Thank you.
We can move on to item 6, request for approval of a new professional service agreement with Community Forward SF.
Hello, Commissioners. I'm Robin Candler. I'm the Director of the Permanent Housing Advanced Clinical Services Program.
Good afternoon, Commissioners. I'm John Uselman. I'm the co-CEO at Community Forward.
So I'm here to present the new contract with Community Forward for behavioral health services for residents of permanent supportive housing sites. The purpose of this agreement is to implement behavioral health teams who will respond to behavioral health needs across the Department of Homelessness and Supportive Housing's permanent supportive housing sites as part of the DPH Permanent Housing Advanced Clinical Services Program, FACS. FACS is a collaborative effort between DPH and HSH to provide behavioral health and physical health services that support housing stability and improve the health and wellness of formerly homeless individuals. As part of FACS, Community Forward provides critical mental health and substance use disorder intervention, engagement, support, linkage, and care coordination services to people who are living in supportive housing sites. These are HSH contracted supportive housing sites, 146 buildings covering 9,000 individuals. Clients are referred to Community Forward by PSH site staff and DPH partners, and they receive individualized treatment plans that focus on immediate de-escalation and stabilization, crisis intervention, case management, evidence-based interventions like motivational interviewing, and referrals for ongoing treatment and support services. This contract, funded by Prop C, is the result of a solicitation for behavioral health services for residents of permanent supportive housing. The contract term is 4/1/25 to 6/30/27, with the possibility of contracting for up to 5 years.
Is there any public comment in the room on this item? No public comment, Commissioner.
Right. Commissioners, questions on this contract? I'll start with one, which is, how does this program work if you have 140 buildings that you're covering and you have actually a number of hours under your staffs, but how is it that they're connecting between the client and yourself? Is it a call from a supervisor? Is it that you make rounds every month on 140 buildings or what?
Good question. So we get most of our referrals from on-site staff in those buildings. So the case managers on site that know the individuals the best, know who's in crisis, send in a referral through a form to our team. We get those every day. We have a triage team that looks at those referrals and figures out who best to respond. So on the larger FACS team, of which Community Forward is a part of, we have health workers, behavioral health clinicians, nurses, nurse practitioners, and we figure out, is this a medical need? Is this a behavioral health need? And we triage it to the right staff. So the behavioral health cases will mostly be going to the Community Forward team.
So that's sort of on the passive side. Is there any active side in which you do go to all the buildings and ask them if everything's going well or so forth.
Yeah, that's also very important. So when we're responding to referrals out at these 146 sites, we're building the relationships with those sites. And so every time we go and we're responding to a new referral, we're also checking in with the case management staff on site and with other tenants and residents in the buildings and making sure they know about our services and keeping the services at the forefront so that when issues come up, they will know to reach out. We're also doing a lot of training and capacity building with the on-site staff. So that things like connecting folks to primary care or connecting them, in the most basic cases to behavioral health services, the on-site case managers will learn the processes to do that. So they will only reach out to us for more acute cases.
Great. Your last statement actually answered my last question, which was how you were interacting and how the facilities knew that you were there. So thank you very much for that. Commissioner Guillaume.
So I did have a question. Thank you. So this new contract it's an expansion of what you're already doing, focused on the sites that you're already in or not? And then in addition to that, is there new staffing or do you already have staffing? Or is that going to be an issue in order to be able to fulfill the terms of the contract?
So we currently have a small behavioral health team within the larger FACTS team. So 3 behavioral health clinicians and supervision of those folks. But this contract with Community Forward was planned from the beginning to be the bulk of behavioral health services. And so it's a much larger behavioral health team, and they're in the process of hiring up for clinicians right now.
So if the hiring sort of gets delayed or, you're not able to find all of the sort of qualified folks to train or already trained, how will that affect the rollout of the services?
We're currently, the FACTS team has been around for 3 years now. So we've been providing the services with the existing staff that we have. Our clinicians are stretched thin, and we're doing a lot of training of other folks on the team to prioritize and refer just the acute cases to the clinicians. But we're very hopeful that additional staff will allow us to provide more intensive services to this community.
And that will be monitored by the department in terms of whether the ability to carry out the contract services is going to be hampered by. I just know that not just for this program, but for in general around mental health and behavioral health, services that being able to find and retain qualified folks. It's not anybody's fault. It's just what it is. And so just hope along with you that the qualified staffing is not going to hamper the ability to do this important work.
Yeah. Thank you.
Commissioner Guggenheim.
So we've been hearing a lot. Oh, sorry.
No, it's okay. You're on, but just speak loudly, please.
Yep. We've been hearing a lot about the mayor's new programs with the street teams and housing. I'm wondering, are you coordinating in with that? Or maybe that's even a question for.
So the answer is yes.
We turn the microphones on. Okay, I'm gonna give you another one. Keep talking.
You're just unplugged.
All right. So there are 2 pieces I just want to note that I think that are important context. One is that as part of the Commissioner, your question around how this links into the Breaking the Cycle initiative and the broader pieces with the mayor's office. This is very much integrated into that in the sense that we are trying to make sure we can actually have more clinical treatment, supports, care for folks where they live instead of waiting for us to find them in the ED or on the streets. And so this expansion is one part of that. It's a very important part. I would also note that, and I'll talk about this actually at the next meeting later today when I walk through some of the investments in the mayor's budget. We have a strategy to try to increase even more the right service and treatment models in both shelter and permanent supportive housing settings. A lot of that work is going to be done is not just in the future tense, is currently being discussed with HSH. And so this contract reflects what we're able to expand to right now. We are also thinking about very different models of how we get more clinical supports, whether it's a roving model or site-based model in permanent supportive housing and shelter, and how to leverage Medi-Cal reimbursement and funding as a primary revenue source for being able to expand the services. What we are expanding now is the extent of what we can with the sort of revenue sources you see here, but we should be able to find new ways to get more Medi-Cal reimbursement for these sorts of clinical services that are covered by Medi-Cal and deliver them in settings where people actually are.
Thank you. Did that answer your question?
Yes.
Okay. Are there further questions? If not, it's in order to have a motion to recommend to the commission.
Okay. Oh,
I'm the second.
I'll recommend approval to the full commission.
And that's
Make
second.
motion, yeah.
All those in favor?
Aye.
All right, thank you very much.
Thank you, Commissioner. Have a good
Thank
day.
you.
We can move on to item 7, request for approval of a new professional services agreement with Latino Commission on Alcohol and Drug Use Services of San Mateo.
Good afternoon. My name is Kelly Hom. I am the Director of Substance Use Services for San Francisco. I am joined in the room with the Executive Director of Latino Commission, Deborah Camarillo, and Sal Blancas, the Program Administrator. We are here to request approval for a new agreement with Latino Commission to provide a 6-bed residential services for youth under the age of 18 who are residents of San Francisco and Medi-Cal beneficiaries. Just as a little bit of background, this is in response to a finding from DHCS where we did not have residential services for youth in San Francisco. As a result, we issued an RFP and Latino Commission was our winner. This service provides dual diagnosis services to individuals, so they have expertise in SUD as well as mental health services. The facility is actually located in Daly City, but Latino Commission in general as an agency has facilities who we have contracted with for our adult services located within San Francisco. This facility would provide 20 hours of co-occurring treatment for each youth, including treatment planning, care coordination, group counseling, individual counseling, family therapy, collateral services, medication services, and they have a partnership with San Francisco Unified School District to provide individualized learning plan. I also want to note that Latino Commission, while they serve all populations and any ethnic background, they have never lost sight of their Latinx values and culture. This contract would be, this agreement would be for $3,952,000, which includes a 12% contingency for the term since September 1st, 2024 through August 31st, 2026. The first year of this contract has been met with several delays. So in order to get licensed to treat youth in a residential setting, they need to go through several different certification processes. And so these first 2 years have been considered their startup. They're well on their way to getting certified in both for DHCS ODS Level 3.1 ASAM residential services, as well as community care licensing to be a group home for youth. And I just wanted to also note that they have exemplary services in their existing contracts. I did bring some of their other monitoring reports from the other contracts within the city, and both are commendable and they exceed standards. Finally, I wanted to address the question that was that we got ahead of this meeting. There was a question about the rates that were being provided. And I wanted to just assure the Health Commission that the rates that we have published in this agreement are consistent with the rates that we pay our other providers. One thing to note that the services that are for that are provided by our physicians typically are in 15-minute increments. So that's when we typically will have the services. But for the purposes of the memo, they are listed in hourly increments, which makes them seem much greater. Any questions?
Is there public comment on this item in the room? See no public comment, commissioners.
Thank you. Before I get from our fellow commissioners, I was the one that asked about the physician, which then becomes even more of a concern. I don't quite understand if these unit costs are in 15-minute increments, then the hourly rate of a physician is somewhat high, it seems to me. I mean, it's like $5,000 an hour. So there has to be more than that actually is part of this care coordination, or else maybe we're calculating differently than I do.
So at 15-minute increments, then it's about $350 per hour. And what we do is we take the rate that we would have gotten from the state and we pass along a certain percentage.
Kelly, I think these are expressed in hourly terms. you're
Yes,
saying.
these are expressed in
So you have
hours.
to divide by 4 to get to the 350-ish for the actual.
Right, that's why I thought perhaps I was misunderstanding that because what I thought you said was that these were in 15-minute increments. And that's where I get nearly 5,000. If they're by hours, okay, you know that we have.
And you would always
expensive-
almost never have a physician billing 1432 because their consult is not going to be an hour long. It would be more like a $350 charge. or
Right,
something.
okay. No, thank you for the clarification. Commissioner Guillaume.
Just a clarification. So the site that is being certified now, that's a new site. So it's going to be, is it specifically for the clients that are going to be now residing in that site?
Yeah, so even though the site is located in Daly City, the population that we are contracting for are San Francisco
No,
residents.
I understand that. I'm just, the facility itself, it's a new facility?
It's
or
a
is-
brand new facility.
Okay.
Yes,
All right. And so but it is located in Daly City.
it happens to be located in Daly City. Yes,
Thank you.
thank you.
It's located in Daly City. It's not located, I mean, I understood the agency says of San Mateo.
The actual site where the youth will be housed is located physically in Daly City.
Is there some reason we didn't locate it in the city?
It's probably very difficult. Maybe the contractor can say, but it's probably very difficult to house.
I should give context. This level of care, residential treatment for youth, is an area where we have had a lot of challenges. And currently, prior to this, we do not actually have, as we're required, this level of service. So we've been issued, I don't know if it's formally called a corrective action plan or something from the state, because we are the behavioral health health specialized managed care plan. So it has been a challenge being able to find and open a sufficient site. The state has actually required that we maintain at least a certain amount of capacity. And so we're grateful to the Latino Commission for being able to step up to help us do that. They've been able to locate space in Daly City, and that's part of the challenge of trying to historically get this level of service off the ground.
Surely, no, I understand the need for the requirement and the fact that this is situated in San Mateo, and we have other issues from other more complicated cases that are also outside of the city. But I was wondering, this is only a 2-year contract, whereas you're saying that the agreement itself allows up to 9, and we've normally been looking at possibly using 5 as a point that will come back to us. So why was this only 2 years, since it is sort of a state requirement to have this facility?
So we wanted to make sure that we have the right structure, whether it be like cost reimbursement or fee for service. And so having a shorter period of time allows us to figure out the utilization and then make a better judgment in the coming years.
Okay, and you know that negotiations have been going on since 2024, but does that mean that we don't have people there, or we do actually have residents there at this point?
Currently, there are no clients in the residence.
I see. We're still out of compliance until we actually.
Yes,
have
yes,
this. Okay.
yes. And we actually are awaiting certification before we can open our doors to clients.
Sure. Any other questions? If not, then a motion's in order to recommend to the commission.
I'll move recommendation for approval.
A second.
All those in favor?
Aye.
Aye.
Thank you.
Thank you.
And commissioners and everybody in the room, we are running a tiny bit behind, so let's try to move forward as quickly as possible. Item 8 is request for approval of a new professional service agreement with Regents of University of California Children and Adolescent Services.
Hi, Commissioners. My name is Farnaz Farman. I'm the Director of the Children, Youth, Family System of Care. And with me remotely is Dr. Barbara Stewart, who's at UCSF Child Adolescent Services, the contractor we're working with. This is a request for approval of a new professional service agreement with Regents of the University of California to develop workforce capacity across the children, youth, and family system of care and delivering 2 evidence-based treatment models. The first, parent-child interaction therapy, or PCIT, and the second, the modular approach to therapy for children with anxiety, depression, trauma, or chronic problems, MATCH ADTC. This is fully funded by a grant through DHCS Children Youth Behavioral Health Initiative, the Workforce Training and Capacity Building domain. And it's the contract totals $1,380,075, which includes a 12% contingency for a term that lasts through June 30th, 2026. We were one of 67 organizations awarded in the Parent and Caregiver Support Program for Parent-Child Interaction Therapy, and one of 192 organizations that was awarded in the round 2 for trauma-informed programs and practices for MATCH ADTC. Parent-child interaction therapy is an evidence-based practice for young children with behavioral problems. So those that display tantrums, defiance, aggression, hyperactivity, ages 2 to 7, and their caregivers. It focuses on improving the parent-child relationship and teaching parents specific skills to manage their child's behavior through the use of live coaching by the therapist. And then MATCH ADTC is an evidence-based practice for youth and adolescents aged 6 to 17 experiencing anxiety, depression, trauma, or conduct problems. It's an innovative system designed to address multiple concerns in children and adolescents by combining different treatment components into a single flexible system. It's kind of like having a toolbox of evidence-based techniques that the therapist can use and tailor to the child's specific needs. For the PCIT program, we have a cohort of 16 clinicians getting certified across our civil service and contracted organizations, and that representing a diverse set of sites and client populations. The target is to serve 40 to 60 families through June 2026. And for the MATCH ADTC, we're targeting 20 mental health clinicians to be certified with a secondary goal of 7 MATCH supervisors. and the cohort will serve approximately 384 families by the end of the grant period. Our contract with UCSF Child Adolescent Services is cost reimbursement since it's a grant for workforce development, training capacity. Haluna Health is the fiscal intermediary on behalf of DHCS. We provide bi-monthly progress reports to them on implementation milestones and various data requests, and then we get reimbursed based on those milestones. So the monitoring includes an implementation, fidelity, training, outcomes, service delivery, and equity goals. And our definition of success and outcomes aligns with this. We're going to be tracking the number and percent of clinicians trained and certified, the number of clients and families who complete the full course of treatment, measurable clinical improvements among clients with various measurement outcome tools, as well as the fidelity to the treatment model. In terms of UCSF Child Adolescent Services, they do have a longstanding partnership with our department, delivering outpatient specialty mental health services, and they're contracted for a Forte prevention program, which is a program that reaches newcomer youth. And their monitoring cycles they've always received meet standards or higher across all domains. And Child Adolescent Services also has a robust track record of capacity building and delivering evidence-based treatments. There's a long list of evidence-based treatments they deliver, in addition to more than 200 trained facilitators across San Francisco and beyond in the Forte model. They also have an APA-accredited psychology internship program focusing on immigrant and trauma-impacted youth. And I'll take any questions.
Is there any public comment in the room? None. No public comment.
Commissioners, that was a very well done presentation. Are there questions in regards to this? If not, then a motion for recommendation to the commission's in order.
I'll move approve recommendation for approval.
And I second.
All those in favor?
Aye.
Thank you so much.
Thank you.
All right, I'm moving on to item 9, request for approval of a new professional services agreement with the Homeless Children's Network, Youth Drug Medi-Cal Organized Delivery System.
Hi again, Kelly Hom, Director of Substance Use Disorder Services for San Francisco. So before you is a request to approve a new contract with Homeless Children's Network to deliver organized delivery system of levels outpatient services, early intervention, and intensive outpatient services. Prior to this, we were on a cap for not having early intervention and intensive outpatient services. So once again, we wrote an RFP. Homeless Children's Network was awarded. And we're pleased to work with this program. They have, while this is a new contract for us, they have existing services throughout the system, and all of their previous monitoring reports for those other programs are commendable or exceed expectations. This is a contract for 3.75 years with a total amount of 8.9 million with a 12% contingency. Any questions?
Thank you. Any public comment in the room? No public comment, commissioners.
Commissioners?
Just a question as to why we needed a corrective action plan. What was the difficulty in establishing these services prior to that?
Yes, we just didn't have any applicants or any providers who are taking on this level of care for youth specifically. So
this will be new for the Homeless Children's Network to provide these services?
yes, this is a new service for them. Mhm.
And how will they, just again, how will we make sure that they?
Sure. No.
Yeah.
It's very, very similar to the services that they're providing to our adults systems. So, it's analogous to other services that they are providing. And so it is taking a more SUD focus as opposed to the co-occurring focus that they had previously.
But adults are quite different from children.
I'm sorry, I misspoke. There are other services for youth So they have youth co-occurring services. And then we would be adding an SUD focused services.
Okay, and then again, how will we, given this is new, is there sort of an interim assessment prior to continuing?
So
the
we have been
services?
providing technical assistance along with just what are the requirements for ODS service delivery. So our program manager, Rebecca Matthew, maybe on, who has been providing technical assistance to the program and working closely with Kenneth Kim on program design to make sure that this meets the needs of youth for SUD services.
Could you call out that person's name again?
Kenneth Kim.
Oh, no, I'm sorry. I thought you said a different person.
Oh, Rebecca Matthew is the program manager. I am not sure if she's on.
I'm here.
Thank you.
Yes.
Oh, are you all, do you feel like she needs to speak or to continue?
Yeah, Rebecca, if you wanted to speak on the technical assistance that you've been providing to the provider.
And please turn on your camera.
I am so sorry. On this, it says audio only mode.
Okay.
I sorry about the link.
That's fine.
It
Go
said audio only mode. Forgive me. Yes, I meet with Kenneth Kim, who is the COO, and the Quality Management Director, Matthew Ivy, separately once a week. And I provide information on technical assistance training on not only the DMC-ODS drug medical system, but also service provisions, required documentations. We also create policies, workflows. So we've been doing that for several months since the inception to get them ready. In addition to that, we have also sent them to various trainings, formal trainings done by our system as well as external systems. Not just those two individuals, of course, the team of people at HCN. And we will continue, I will continue with my team to provide technical assistance on an ongoing basis. Thank you.
Okay, thank you.
Commissioner, question? I guess my only question is that since this contract goes back to October 1, we've been doing that during this period of time? Or we're waiting until the contract passes before we?
No. We have been actively providing the technical assistance, having the participants enrolled in training.
And so all that will be charged against this contract?
Yes.
Yeah, okay. Thank you. If there are no further, did you have any questions? Then a motion is in order to recommend to the commission.
I'll move a recommendation for approval.
And I second.
All those in favor?
Aye.
All right, thank you.
Thank you.
Move on to item 10, request for approval of a new grant agreement with the San Francisco AIDS Foundation.
Good afternoon, commissioners. My name is Robertson. I'm an overdose prevention contracts manager for behavioral health with DPH. Thank you for hearing this item today. Approval is requested for the San Francisco AIDS Foundation peer-led contingency management program, which builds on their existing harm reduction work, notably the Stonewall Project, to include contingency management cohort cycles. SFAF will serve clients through rolling 8 to 12 week contingency management cycles with weekly drop-in support and linkage to treatment, as well as partnership with the Potrero Hill Health Center in the first year. The program will include urine analysis, testing, goal setting, redeemable incentives for stimulant-free samples, all tailored to the individuals often who lack social support systems. The foundation will also conduct a community needs assessment to ensure that the services reflect the population's lived experiences and needs. This initiative directly aligns with SFDPA's commitment to culturally responsive, community-rooted overdose prevention models, and will serve as a new point of access for contingency management in San Francisco. The contract is fully funded through the opioid settlement fund and it complements the overall strategy in reducing overdose deaths in San Francisco. Questions?
Any public comment in the room? No public comment, commissioners.
Commissioners, I'm actually appreciative of the monitoring report items that you have put into the contract so that we understand how you are going to evaluate the program. Commissioner Guggenheim?
Yeah, I only have one question. It says here that you incentivize clients through cash rewards to change their behavior. Is that an important part of the program, or does it work, or what?
I'm sorry, I didn't catch the last part.
You have in here that part of the program is to incentivize clients through cash rewards to change their behavior.
Yes.
And I'm just wondering if that works, if that's an essential part,
Thank you for
does that work?
Yeah, thank you for that question. So contingency management, it remains as one of the most effective interventions for reducing stimulus use disorder, and also has demonstrated success in treating opioid use disorder. Basically, the incentives, it basically helps people stay in the program, and that additional support keeps them coming back. And there's a lot of evidence around that, and there are a lot of examples throughout the country of programs that use the cash incentives that has shown significant success. However, I can give the opportunity to the organization to actually share in their own experiences how that has worked for them, because they've been doing this for a long time. Kyle, are you on the line? Who from SF ACE Foundation is available?
Repeat the name.
So the person that I requested to join us is Kyle Temple, the AVP Behavioral Health and Community Programs at the San Francisco ACE Foundation. Or if there's anyone else.
I would just add, Commissioner, I think contingency management is it's an evidence-based practice, as you heard from Robertson, particularly for folks with stimulant use, meaning methamphetamines, for example. It's one of the only evidence-based parts of the toolkit that we have. When folks are using an opioid or including a synthetic opioid like fentanyl, we have pharmacological, meaning drugs, medication-assisted therapies that can support those. Those don't work for stimulant use. And so contingency management is kind of the only, or one of the only, evidence-based gold standard treatments. We in San Francisco have done a lot on this relative to other parts of the state and country, but these programs are still very, very small. And so we're looking for providers to help expand that. So hopefully that answers it. That yes, the cash piece is actually part of the evidence-based treatment that shows impacting outcomes where current medicines, drugs are not actually effective for people using stimulants.
And if I can tag along, you all approved Glide, a contract with Glide to do the same service at the last meeting, the Finance and Planning Committee meeting. So this is, again, the DPH trying to expand the number of folks to do this. And this organization was one of the first in the city and in the country to actually do this successfully.
Okay, thank you. Any further questions? If not, a motion's in order to recommend to the commission.
Oh, I move a recommendation to approve.
I second.
All those in favor?
Aye.
Thank you very much. Item 11.
Sorry, just wasn't the person from San Francisco AIDS Foundation went over to Glide?
Yes.
Yeah.
Mike, I forgot his last name. Starts with D. Yes, right.
Mike V.
Yes, Mike V. He's fantastic and got his experience at the AIDS Foundation. Good memory. Item 11, request for approval of a new grant agreement with Health Right 360 to perform contingency management. There we go. We got another one.
Hello, it's me again. Robertson Sumwama, Overdose Prevention Contracts Manager. We are requesting approval to fund Health Right 360 to provide mentoring and expand contingency management services. This evidence-based behavioral health model uses cash and other incentives to reduce stimulant use and opioid overdose deaths. HR 360 has over 30 years of experience with SFDPH and will mentor 2 newly funded CM programs, Guy Foundation and Safe AIDS Foundation, helping them build and operationalize low barrier CM programming. In addition to mentorship, HR 360 will expand its own continuity management services through 2 new sites, Lee Hardward Counseling Center and the African American Healing Center. Targeting high-risk communities, the program welcomes and serves all ethnicities and populations within San Francisco with a focused expertise to meet the unique cultural needs of the African American community. Services will include CM cycles, case management and health navigation services, client-centered strategies to remove access barriers. This contract supports the goal of integrating CM into a larger system of care and improving access to treatment through outreach, capacity building, and peer workforce development. And it's 100% funded through opioid settlement.
Any public comment in the room?
I do.
I see none. Commissioners?
So this is a program that will help sponsor 2 mentees
Yes.
and anything else? I mean, you have a whole list of things that are being done, so.
Yes. So the initial RFGA was put out to bid and different organizations applied for it. The organization that won, this specific one, was Health Right 360. And the first year, they're supposed to do the mentoring. However, the second year, they're going to apply whatever we're funding them to support their own established continuity management program by expanding their current program to 2 additional locations.
All right, so it's not just purely supporting mentees.
No,
but-
that's only for the first year. The second year is for them to support their own program with the money.
Thank you. All right, Commissioner Guillaume.
So with Glide SF AIDS Foundation and Health Right 360, that's the extent of the contingency management expansion in San Francisco?
There are multiple CM programs throughout the city. However, these were the specific 2 that they were going to be mentoring. However, we are going to have further discussions to see if they can put resources available for all the organizations in San Francisco to be able to have access to.
We could get a full list of all the providers. And I believe we DPH also do some contingency management with our civil service staff and some of our clinical settings.
Thank you.
Thank you. Any other questions? If not, then a proposal for approval by the commission, it's in order.
Okay, I recommend approval to the full commission.
I second.
All those in favor?
Aye.
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 Thank you, everyone who's gotten us this far. Now we move back to item 3, the monthly contracts report. And again, everyone, let's do our best to be concise.
Yeah. Afternoon, Commissioners. Jenny Louie, Chief Operating Officer, here to present the monthly contracts report. Although I do have to thank Ms. Ruggles, Mr. Mock, and Ms. Jones for really preparing the materials before you today. As noted in our memo, you have 15 contracts for your consideration at this committee's report. In addition, you have a summary of the annual program monitoring report. And as noted, all organizations receive an overall program score of acceptable, meets standards, or commendable, with some comments given, as well as a summary of fiscal monitoring reports, which appear to be conformant with some additional comments as well. And I know sometimes those comments are when you see, a plan of action that could feel a little bit concerning. For me, thinking of the glass half full, this is actually a sign that our annual monitoring process is working well. We're actually catching these things. We have a plan of correction. We're proactively addressing them. And so some of it is matter of course. Obviously, we wish that there be nothing, but also be a little suspicious if we never found anything, in which point, like, what is the point of annual monitoring? But you do have that information before you here. All right. And so what I'm going to do is I'm going to present a set of contracts if there's a sort of a relationship, and pull them all up together, and just in the interest of time. So the first set of contracts you have before you are increases to not exceed to amounts to just reflect our current spending levels. There are 3 contracts here. The first one is A Better Way, which extends which adds about $500,000 annually
to a contract that was originally 1.2 million to continue services as is. The second is the Public Health Foundation, which adds 268,000 annually for an annual amount of 676 through the end of this calendar year. And then actually a reduction in the Salvation Army Harbor Lights contract by 1.2 million to reflect a transition of 22 beds that are actually in a different contract that was previously approved by the commission earlier last month. And so that's, to Commissioner Chow's question, why is the actual amount going down, is because we've moved those additional beds into a different contract. So the overall amount is reduced. But however, because this original set of beds was funded through a grant through 2026, we did want to maintain and ensure there's sufficient funding through the term of the contract. Program staff are here if you have any additional questions beyond those submitted.
Commissioners, first, I think we want to thank Ms. Louie for really an excellent summary of what, 15 or so contracts that are being brought to our attention here. With that, then, I think the idea of presenting as you are in these groups will be helpful to all of us also. So Commissioners, the questions will be on the first three contracts.
No questions.
Any questions? No, thank you. We'll proceed to the
Great,
next
thank
group.
you, Commissioners. The next set is an additional 3 contracts where we're actually just extending the term. So there's no change in scope, no change in the annual funding, but so perhaps some variances. But overall, we're just adding additional years with associated funding just to fund additional terms. The first one is the Justice and Diversity Center. This contract is 100% funded through an HSA work order, and we're continuing, we're adding 4 years to it for 1.4 million annually in support of these services. And then the remaining 2 are actually 2 that are related to a federal substance use block grant because the state has actually been delayed in providing an update to its policy recommendations for funding. What we are asking for is a 2-year extension of the existing services as is until we actually get information regarding the state's updated guidelines. And the state has to go through its updated process, its noticing requirements and the like before it finalizes its guidelines. Then we have to take those guidelines, turn them into an RFP and ultimately contract. So we're asking for 2 years just to be a little bit conservative to make sure that we have enough runway to incorporate the updated state guidance. But in the meantime, we are requesting to maintain services as is for those 2 remaining contracts.
Yes, Commissioner Keown.
Just a question on the Justice Diversity Center, the way that the funding flows works. So we get a work order from the HSA and then we fund the Justice and Advocacy Center because of the nature of the services for those clients. Is that it in a nutshell, or is there
Yes,
something?
I mean, yeah, it's 100% funded by a human services agency.
Sorry?
Yes, it's 100% funded by human services agency work order. So no DPH general fund is a part of this.
And then,
we're the contracting vehicle for them.
And then we monitor that.
But because it is our contract, we will continue to monitor it as we do through our annual monitoring process.
But do they go to the same sort of BOCC compliance monitoring process?
Yes.
And then do we report back to the HSA that the use of funds was according to their work order?
Yeah, I expect so. And in terms of that, but Max, I'll defer to Mr. Roche.
Hi, good afternoon. My name is Max Rocha, Director of Systems of Care Behavioral Health Services. So yes, we do report back to HSA for the work performed, including units of services, unduplicated clients served, and so forth. The earlier question was whether these services are for our Medi-Cal members. Yes, it is for our members.
Okay, thank you.
Thank you.
Commissioner, any questions? I did want to comment for the public here, especially that we have also received from Ms. Louie's office the contracts management fiscal reports on each of our contractors and the Business Office of Contract Management recommendations. So all of these have been reviewed by our committee ahead of time. It was very helpful for us so that we didn't have to ask added questions beyond those that we are now asking. So we really want to thank you and your department for the work that you put in order to help create a more streamlined process for our contracts. Thank you.
Great. You're welcome. Although the credit really does again go to Mrs. Ruggles as well as the Business Office and Contracts Compliance team. But we are glad.
We'll convey our thanks to her also, and thank you. So we can go on to the next batch that you have.
Great. So I'm going to take these in sort of three batches again, because the next set, they're all new contracts to continue existing services, 9 contracts in total. I'm going to take the first set. They're all related to UCSF. The first 2 are actually related to Laguna Honda. The first one is dental services, where we're creating a new term for 3 years for dental services for our residents with an annual amount of $571. Commissioner Chow, you did have a question about what the prior year units of service was, and what I received from program staff was in 22-23, there are about 1,200 units of service delivered, 23-24, 861 units of service. In current year, year to date, we have about 755 units of service and project to hit about 825 by the end of this fiscal year. In addition, we have a contract to continue the clinical practice group services for $1.5 million annually for an additional 3 years. And separate and outside of Laguna Honda is the UCSF tertiary care contract, not to exceed the amount annually of $8.4 million, $2.1 million annually for a 4-year extension for services for some of our clients that are not covered. I'll pause here since that was a mouthful.
Thanks. Commissioners, questions?
Just a question as to, so these aren't services that are Medi-Cal billable? Or is that how it works?
You know, I think that
general fund funded.
Yeah, I think it's because it goes into our whole per diem cost report because of how the skilled nursing facilities are billed. They're billed at a per diem rate. We do submit cost reports. These costs are included in our cost reports wherever applicable. And then those services, and then it's sort of rolled up into our actual rates. So like, but this, it's hard to just sort of like look at what percentages is actually drawing down. But if you like overall, as you know, Laguna Honda does, I don't have the number on top of my head, but I want to say it's about 75% reimbursed through federal sources, primarily Medi-Cal and Medicare. And so it's sort of rolled up, it's implied there in terms of like how this contract is funded, it's general fund, but it is offset by the additional per diem revenues that don't go through directly through this contract, as you would normally see and say, unlike a behavioral health services contract where we bill directly like for the services, like and we have those percentages or the expectation of those percentages. This one is part of the larger skilled nursing machine, per diem rate machine in terms of cost reimbursement and cost reporting.
Okay, thank you.
Okay.
On the contract for the CPG, is the reason this is then separate from a CPG contract that we may have at General, or is that one under the overall professional contract? Well, it's not a professional contract, but just sort of let us know again how the professional services are being billed as versus our university contract at the General.
Great. Roland Pickens, CEO, Director of San Francisco Health Network. Thank you for that question, Dr. Chow. So this is for the UCSF specialists who are based at San Francisco General, but come over to Laguna Honda to provide specialty clinics, cardiology, GI, orthopedics, those types of things. So these contracts have been in effect about the last 10 or 15 years. The UCS specialists come to the outpatient clinic at Laguna Honda, and Laguna Honda does the type of billing that Jenny just talked about. It bills for any services that are not covered under the all-encompassing long-term care rate.
Good. So this is outside of our other UCSF.
Yes, this is
contract.
outside of the affiliation agreement. These are standalones.
Right. And so I personally really appreciate the transparency in terms of discussing the various specialties that we do have at Laguna Honda. I think a lot of people don't realize that as a longer term nursing home, there are almost no nursing homes with that type of level of service right on site. So appreciate that. So then the other contract, which is the tertiary care contract, that is the one that we've had for a long time.
Correct.
From SF General, right? So
That is correct.
things that we don't do, such as bypasses and so forth.
You
up to
took the words out of my
general
mouth. Yes, exactly.
And we've not exceeded this max that we'll put in for all these years.
Yes, we've never exceeded.
Okay, thank you. Any other questions?
Mm-mm.
If not, then we can move on to our next batch.
Okay,
please.
thank you, commissioners. The next set are two citywide case managers, citywide case management contracts with UCSF. These two contracts are, we're splitting out these two services in these locations to simplify an existing contract that actually had 11 programs. And so we thought it would be easier to manage moving forward as there were multiple program managers in this. But we are continuing the services for the terms for additional 5 years, 3.1 for the for MINA project and roving teams, and 1.3 million for the STOP and SUDS program, but maintaining the service levels in a new contract for 4 years.
Do you
Oh, and
wanna
then there
explain
was a
to the
question
commissioner-
about the rates, and we have program staff here, but overall, I mean, we are beginning to improve our billing. And I think the assumption that I think Commissioner Guillermo had was that there was a 34% billing rate that we were assuming as part of the contract. This is obviously something we're going to continue to assess and monitor, particularly with some of the financial news we have. But right now, this represents our best thinking. Obviously, we are not limited to that 34% in the contract. If they can generate more, we will. And that's something you've actually also seen in some of our financials. Like you see our quarterly statements, sometimes revenues, particularly in behavioral health, are higher than expected in budget. There's always some ebbs and flows, but you'll see those variations. So we would not obviously stop collecting because, you know, they've hit their 34%.
Could you remind us what this new authority is in terms of governmental contracting? That question has come up.
Oh, the government to government contracting. This is a new piece of legislation that allowed us to facilitate some of the contracting directly with other government agencies, and also allowed us to bypass some of the RFP selection requirements because we are working with another government to government entity. And I know Ms. Ruggles is here, so please keep me honest on this. But in terms of like, this was originated a result of some of the issues we saw where our city attorney would actually be concerned about some of the boilerplate language of another state agency. And then we were sort of at this impasse between the attorneys, between like, two different government entities trying to reconcile. And so the government to government was really, meant to facilitate and recognize that, that there are requirements and that we did not need to go to the board for every single adjustment around indemnification clauses and the like within it. But it also does facilitate the authority to make selections directly with existing government entities without going through a full-blown RFP process. But it obviously does not preclude us from doing so if we choose.
Okay.
Right.
Thank you. Does that help you, Commissioner Guggenheim? Okay, thank you.
Okay. The last set is for contracts related to our registry services. And I will note in my memo, I did not characterize it entirely accurately. I said these services were for ZSFG and Laguna Honda. They really are for the entire health network for both RN and ancillary services. And so it goes beyond those two organizations. Obviously, they are the bulk of those of the consumers of the contract, but not limited to those two organizations. And we are, I know that there's been some changes in terms of how we had multi-year contracts, tertiary, we had the ancillary services and the RN services split up. And so I do want to bring up Mr. Williams because we've done so much work around both these contracts, the registry utilization, the contracts themselves, as well as our nurse hiring. And I think it was just worth a moment just to have him say a few quick words.
Good afternoon, Commissioners. Troy Williams, Chief Nursing Officer for the San Francisco Health Network. Good to see you. Just a little bit of context on the nursing registry contracts. In March of 2024, we developed a centralized process in terms of approval and requests, and it's all under my office as the Chief Nursing Officer. And so from that time, data-driven, making sure that, we are only using registry when we need to. Our priority is to use regular PCS staff. And so as a part of this, we've been able to, really be strategic in terms of how we're using registry. So over the last year, with the last contracts, as those come to an end, we've been able to really have some very clear projections of what we think we're going to need, which is different than what we've had historically. I think, historically, different parts of the network controlled their own parts of registry. Now it's all central. And so now what we've done with these new contracts that are coming forward is we have 2 contracts for registered nurses. We have a primary and a secondary, and then we have 2 contracts for non-RN ancillary, so a primary and a secondary. The primary gets first dibs at, if we need them, and they have 72 hours to respond, and if not, then we go to the secondary. And so that's worked very well for us in the previous contracts, and we'll continue that for this current contract. We also have a very robust monitoring process for them. We have quarterly business reviews with them, with some I don't know if you've seen the monitoring reports we have, the actual metrics that we have. So very tight process, and we're excited to move on with these new vendors starting July 1st. So with that, I will say one more quick thing. We were able to, our projection for this year was about $10 million, which is $40 million less than what we spent last year. So with our oversight program, we've been able to save a tremendous amount of money. And it's a huge partnership with HR and finance. A lot of hiring has been happening and a lot of partnering so that we, truly understand our registry use. So it's been a great success with a lot of people involved in it. Answer any questions?
So are you saying that we saved $40 million in contracts due to our accelerated hiring?
That's what I'm saying.
Wisdom, I think.
Okay. Did you, under cross-country staffing, I had asked that we got rates on the other programs for RNs and non-RNs, and for that,
Yeah, I
we
have it.
did not
We,
get any rates.
Yeah, we had sent that earlier. Let me make it bigger. It's for non-specialty RN, $88 an hour, for specialty $102, and then the overtime rate for non-specialty $118, for specialty $137.70.
Okay, so they're fairly comparable.
Yeah.
To the others. Okay.
Yeah, that's the other thing that's really important with this process. And it's strategic for us to go annually for these contracts because we've been able to maintain the most competitive rates. So in talking with other chief nursing officers from other health systems, we're sharing rates. And so, last year, or the year before last, we were really getting charged outrageous rates for registry. And now we're in line, and in some cases, kind of best rates in the Bay Area for registry, which has been great for us too.
Very good.
Yeah.
Thank you. Commissioner.
So with the freeze on hiring, is that calculated into the or the projections on the use of registry? And have you sort of been able to see evidence of that projection playing out?
Yes, so the RNs, for example, we've been hiring. We are the other classifications that we're hiring for, LVNs, PCAs, those are moving forward and we're hiring. But the reality is we're not using large numbers in the non-RN except for PCAs, but we are hiring with those now. They've been released.
Oh, all of those have been
Many of
released?
them have, yeah.
And I do want to clarify, I know there is a lot of discussion around the hiring freeze throughout the city. There are about 7 nursing classifications that are not subject to the freeze, which does include RNs. And so they've been released, as Mr. Williams said, but they're no longer going through an additional review so long as the job classification is one of those 7. So it includes RNs. And so we have not stopped hiring. And I am pleased to say that I think we're below a 5% overall rate. And so we're at sort of budgeted levels for RNs as of the last pay period. So, yeah.
Great. Well, it's great to hear that the freeze has been lifted and really great work then on these contracts to streamline and be more strategic. So appreciate that.
Thank you.
Very good.
Mhm.
Questions? No. Okay, so we're prepared for a motion.
Actually, let me just check public comment.
Oh,
Just
yes.
to do it, my due
Of
diligence. Is any public comment in the room on this item? No public comment, commissioners, so please move
Thank you.
forward.
So motions in order to recommend the contracts report?
Recommend approval for the contracts report to the full commission.
Is there a second?
Second.
All those in favor?
Aye.
Aye.
All right, fantastic. Congratulations, everybody, for the great work.
And I do just want to take a moment to thank, again, the contract staff as well as Mr. Morowitz, as well as members of the commission who spent the time pouring through the contracts to support us to make sure that we continue to keep those services moving. We appreciate it.
Think of that. Thank you.
Thank you.
We can move on to item 12, emerging issues.
$1 million.
Any public?
I had one. So as we are streamlining the process, I did have one piece of information that I was hoping that we could get as these contracts are being summarized. Is it possible to get either a list or an amount of the total current contracts that any one agency has that's being has either a new or renewal contract, just so that we can get a sense of.
I see. You mean
Yeah.
if we're contracting with agency X and we would say we have 7 other contracts or no other contracts with that agency.
Yeah, and under which department or which which division within each.
We can provide that in the
Yeah,
future.
there was a listing out of the office there of what all the contracts were, but there was no numerical cost in terms of what they were all. And I believe that would be very helpful to understand. For example, Pellwright 360 has 40 million or whatever it may be, whenever we're looking.
Jen,
The summary that we've received and all the work that's gone into doing it made reviewing the material so much easier. So, yeah.
thank you, Jenny and team.
All right, any public comment on this item? Hearing none, we can move on to public comment. Any general public comment? This would be on items that are not listed on the agenda. No public comment, and we can now go to a consideration of adjournment, commissioners. And actually,
Consideration for adjournment.
take a pause. A huge amount of work that went into everything before and during the meeting, and just congratulations to everybody.
Thank you all.
We need a motion for adjournment.
Motion to adjourn.
Second.
All those in favor?
Aye.
Yeah, thank you. Give me a minute to close it down.
Thank you. Thank you for everybody.